As the coronavirus outbreak has spread throughout the United States and globally, many lives have been lost, and its impact upon our families, friends, neighbors, and communities have been devastating, transposing a new normal reality upon the places where we live, learn, work, and play. During this incredibly challenging time, we stand by all of our local, state, and national public health partners as they work tirelessly and heroically to serve us all. Now, more than ever, we need to attend to the factors that shape health and equity in our society and acknowledge how deeply health and equity are intertwined. The coronavirus outbreak has widened already existing social and economic divides, and its spread across our nation is hastened by income inequality, exposing those living in poverty to greater risk. Even so, every county and every person is at risk from coronavirus. We are all in this together, and we must ensure that everyone is protected in this moment and in the future. Although our neighborhoods may look and feel different right now, we can still support one another as a community, even through compassionate actions like physical distancing. This is also the time for us to advocate for long-term strategies that improve the health and well-being of everyone, such as paid sick leave, better funding and support for state and local public health departments, equal access to full health insurance coverage, and broader protections around housing and jobs. At this uncertain point in history, our shared humanity can be our strength, while the existing and social economic inequities that currently divide us will only make us all more vulnerable. Data shine a light on health inequities, illuminating opportunities for us to come together and take action to improve the health of our communities. For more than a decade, our data have provided a snapshot of the health of every county in the nation, and community resources like our Action Center and What Works for Health have provided guidance and tools to support local change. We want to let you know that we continue to serve as a resource for you so that when you're ready, reach out to us. We are here for you. Stay well from all of us at County Health Rankings and Roadmaps. Hello, and welcome to the County Health Rankings and Roadmaps 101, using data, evidence, guidance, and stories to build healthy communities. After today's webinar, we hope that you will have learned more about who we are, what we do, and why we do it. More importantly, we hope you feel prepared to use data, evidence, guidance, and stories to support and strengthen your work. My name is Carla Freeman, and I'm an action learning coach with County Health Rankings and Roadmaps. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. I'm joined by a small team of colleagues. Let me welcome Annie Rubel, Population Health Analyst, Jesse Soltz, an Evidence Analyst with What Works for Health, and Erica Burrows-Girardi, an Action Learning Coach with the Community Transformation Team. So let's start with the why. Why does County Health Rankings and Roadmaps exist? Why do we produce the tools and resources that we do to support communities? County Health Rankings and Roadmaps has two primary overarching goals. The first two is to improve health outcomes for all. This means supporting communities to improve how long and how well people live. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we were born into, knowing that the choices we make depend on the opportunities we have. Imagine a place where everyone has a fair and just chance to lead the healthiest life possible. A place where high quality schools, good paying jobs, access to healthy foods, quality healthcare, and affordable housing in safe environments. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but are celebrated as fundamental to health and well being. Imagine that this is how we all experience our communities, regardless of where we live, the circumstances we were born into, or how we look. Think about your own community. Who's not thriving? Who doesn't have the same opportunities for health? What barriers have been in place over the years? What will it take to remove them and change the opportunities in your community? This graphic helps us understand why equality is just the starting point to closing gaps. We need more than the same resources or opportunities available to all. For example, the same adult bike would not allow everyone to ride safely to get where they want to go, and some could not even ride it at all. But let's think about an equity approach where everyone again has a bicycle, but the type is based on what they need for their circumstances. Inequities result when there is a lack of opportunity and resources to thrive. In this example, a bike that meets different needs, it's important to remember that these conditions and obstacles are both unfair and avoidable. When we talked about the why, now we will look at the what and the how. As I mentioned, one of our goals is to improve health outcomes. Let's look more closely at this. The image you see here is our rankings model. This helps us understand what drives health in a community. One of the goals we have had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things we often think about when we hear the word health, like health care and how well we eat and how much we move. But we know it's also things like education and income, the quality of our housing, and the safety of our neighborhoods. So with an understanding of what influences health in a community, how can you plan to take action to improve your community's health? The take action cycle is our way of thinking about how to create a healthy community. We believe that community transformation starts with assessing needs and resources, which starts in the upper right hand of the graphic and moves through the cycle to evaluation. Communicate and work together wrap around the cycle because these activities are essential throughout the process. And at the center are the community members, the residents, and the people doing the work. We know that people work together with a shared vision and commitment to improve health. It yields the best results. Putting these ideas into practice takes a comprehensive approach, and we've developed various tools and resources to help you along the way. We work to support communities to bring people together, to look at many factors that influence health, select strategies that improve health for all and close gaps, and make changes that will have a lasting impact. We do this by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as examples and inspiration for you and your partners. We will start with data. In our work with communities, we get a lot of questions about data. Now, Annie will share why data is such an important resource for communities.
Thanks, Carla. The County Health Rankings has been publishing data since 2010, and data is an extremely important resource for communities because it's used throughout formal and informal community health improvement processes. First, it can be used to assess the health of a community. Communities across the country are incorporating county health rankings data into their community health needs assessments, as well as other health improvement strategies. Data can also be a tool for engaging non-traditional community health partners and community members in the health improvement process. It can also help identify root causes of health issues, support decision-making and policy change, and track progress. As communities take action, they have used data from the rankings and other sources complemented together to understand whether policies, programs, or plans are on track to improve health. At County Health Rankings, we provide both health outcome and health factor ranks. We are the County Health Rankings. The health outcome rank measures the length and quality of life for a county within a state. You can see here Fulton County, Georgia, where Carla is located, ranks 13th out of 159 counties for health outcomes in Georgia. The map, which will be familiar to you on our website, shows that the counties are broken down into quartiles, where lighter colored counties are the healthier ranking counties. Similarly, we give health factor ranks, as I mentioned, and for Fulton County, they rank 27th out of 159 counties. And health factors is the composite score of measures that fall into the categories of health behaviors, clinical care, social and economic factors, and the physical environment. If your overall rank for health outcomes is better than your rank for health factors, such as in this case, it might suggest that if you take no further action, your health outcome rank might decline in the future. And the opposite could be true as well. So at the County Health Rankings, we provide a snapshot of health data on key metrics for your county. But what does your snapshot really tell you? So I encourage you, as you're watching this, to go to countyhealthrankings.org, and I'll go there in just one moment, and to type in your county name. Then try to find the data points I'm pointing out in your county snapshot. So when you look at the snapshot, you want to get a sense of the big picture first. And your health factor and health outcome ranks can help you do that. These are in the rightmost column. Next, check your health factors to see which are the strongest and which might need some work. Again, these are the ranks for health behaviors, clinical care, social and economic factors, and the physical environment. They give you a sense of where you're doing in those different areas. And then finally, we encourage you to explore the measures. Within each of those areas, you'll also see the measures themselves. There's over 35 ranked measures, and we provide data. We provide a county data point, as well as the error margin and state level values, and then also a national benchmark, which is the top 10% of counties in the snapshot itself. So knowing what to focus on in your community takes more than looking at just the rankings data, but we hope that this is a great place to start. We've included 2 tools that can give you an additional head start, especially if you're thinking about priority setting processes. If you click on areas to explore and areas of strength at the top of the snapshot, they'll highlight measures that are particularly worrisome or particularly great when compared to the state or national averages. These comparisons don't replace a true priority setting process, but they can give you a quick peek into strong and weak areas in your county that might be worth exploring further. So now I'm going to share my screen and go to countyhealthrankings.org in order to help you navigate the website and find the data. Okay, so now you'll see I've navigated to countyhealthrankings.org, and this is our homepage. And if you scroll down slightly, you'll see you can either type in your county or click on a state and then a county within a state. So I'm going to type in Fulton County, Georgia, and it'll bring me to the snapshot. Okay, so you can see the ranks that I talked about before on the rightmost column, and you also see the measures on the left, or the measure names on the left with their values, and then trend graphs, which I haven't talked about yet, but I will, and then the error margins and the top US performers, again, the top 10% of counties, as well as the state value. So again, the measures are on the left, and I want to point out a couple features to you. One, we can click on any of these data points that's highlighted in blue and underlined. If you open those up, it'll open up a drawer with different race values underneath it. So values for races within your county for that specific measure. This helps you dive into thinking about subgroup data. And again, we provide an error margin here to think about meaningful differences between race values or between the county value overall. In the next column, you can click on the trend graph. You'll see that the icons are colored, coded green, yellow, or red, so improving, worsening, or staying the same. And if you click and open those up, you can actually see the trend graph with the data points that correspond to it for both your county, the state, and the US overall. Another feature I want to highlight here is that under premature death, there's a little eye icon. And if you click on that, it opens, and that brings the top 5 leading causes of death for your county. Again, this is for the 3 most recent years that we use for this measure. They're sorted by the rate of leading causes of death, by the rate of death. But this can really give you a priority setting process to think about what's contributing to your premature death. The other thing I want to highlight is that there's additional measures hidden here. So under all of these plus signs, you'll find demographic data, additional health outcome data, as well as additional measures among the health behavior and clinical care and social and economic and physical environment measures. There's actually more additional measures than there are ranked measures. So we really encourage you to open these up and look at them. These are measures that are not necessarily included because we include another dimension of health, or we might only have this measure available for certain states or different counties. But it's really important to look at all the data and understand what's going on in your county. The other thing I want to highlight is that you can compare counties at the top here. So if you click on the Compare Counties tab, just like you can compare your value in your snapshot to the state or national benchmark, you can also compare to any other county in the US. So you might want to compare to another county, let's say in Georgia here. I'll just give you an example. And then you can look at the county values side by side for all the measures, either ranked or additional. You could also select from a list of peer counties, which provide counties across the nation that are similar to your county. Again, it's another tool for priority setting in terms of setting benchmarks. And let me go next, or back to the rankings, and back to a measure page specifically. So I want to highlight that if you go to any measure page, and let's just click on uninsured, for example, it opens up a map for your state. And then with that, you can click on data, and that brings up a data table. If there's race values available, those will be listed here as well. And then there's a description of that measure. So this includes information that you want to know about how the measure is calculated, why we include it in the county health rankings as either a ranked or additional measure. We also provide information on the data source, so where we're getting the data and the years of data provided. But then we also have the strategies tab. And my colleague Jessie will talk about this a little bit more, but these strategies come from What Works for Health. What Works for Health provides strategies based on a specific measure if you're looking to improve on that measure. So this really helps you guide that actionable items in your county if you're working on a specific measure. The last thing I want to highlight here is if you go to the state page. So I just clicked on Georgia there at the top. You'll see both those health outcome and health factors measures or maps that I showed you in your in the original PowerPoint. But if you scroll down, you'll also find the state reports, which I'll talk about in a little bit, as well as all the data that is available for your state for that year, and some action learning guides, which can be really useful, which Carla will talk about in a bit. But more specifically, this find more data and resources for your state. So we know county health rankings data is limited to the county level, but we know data exists within your state or nationally, which might provide more information at a subgroup level. So we know data changes from county to county, but we also know it might change within a county from zip code to zip code. And so we really want to provide that data for you so that you can look at those differences that might exist within your state. Also on this page are community stories from your state, as well as a contact for your state who's familiar with the rankings. You can always contact them, or you can always contact us. Our community coaches and our data team are happy to assist in any questions you have. So also on the state page, we've included a really neat feature starting in 2020. And this is also available on any of the maps throughout our website. So you can see the values again for health outcomes and health factors in Georgia. But if you scroll to the bottom, you can turn on or turn off cities as well as congressional district lines. So let me turn those on for Georgia. And if you click in a congressional district, it'll auto zoom And then it'll show you all the counties that that congressional district overlaps with and their respective rank for either health outcomes or health factors. This can be a really important way to think about your data in terms of how policy impacts health outcomes and health factors or different measures, as well as it can be an interesting way to think about how geographic disparity occurs within your state. Okay, along with all that data on the website, we also provide state reports each year. And these can be found on the website. I showed you where the link was. And these go along with the data. So our 2020 report explores the size and nature of health differences by place and race and ethnicity in your state. It gives examples of actions that state and community leaders can take to create environments where all residents have an opportunity to live their healthiest lives. Through a series of graphics, our state reports illustrate how health outcomes and some health factors vary among counties, among racial and ethnic groups within states. So this is one of our key graphics in the state reports this year. And this graphic holds a lot of data, so I encourage you to go on the website and play with it and look at it for your state. And again, to contact either a data team member or one of our community coaches to help talk through this data and what it might mean for your community or what this graphic might be showing in your state. I want to emphasize that these are static images in the state report. However, we actually have an interactive app online. If you click on the state reports, it'll take you there, or you can get the link to go there. And you can actually play with the data itself, which can be really helpful to see how the different patterns work. So let me orient you to the graphic itself. So the orange dots are counties within your state, while the gray dots kind of behind them are those gray dots represent counties within the whole US. The arrows represent state level or national level values. And so you'll see that first line, all children, is for all counties in your state, what that children in poverty value is. So you can see the range for Georgia goes from just over 0% to just under 50%, give or take. However, the next 5 lines show that data broken down by race, again at the county level. And you can see that the range varies a lot. So some counties have race values that are almost 0% again. But for instance, for Black children, there's some counties where over 75% of children are living in poverty. And so we've developed, along with this graphic, a series of guided questions that can help you put this information into context to learn more about the patterns that are occurring in your state. We ask you to compare the data in your state to the nation, as well as think about the range of counties within your state, as well as how the range differs by race and ethnicity within your state. The pattern in these data should encourage us all to ask why, and we want to take a closer look at the community conditions in which we live, including past and present policies and systems in our communities that may be limiting opportunities for all youth and families to thrive. Unfortunately, you'll notice similar patterns as you look to multiple states. And again, I want to emphasize that these graphics are available on the web as interactives. And there we also have 2 additional measures, so you can play with children living in poverty, as well as the percent of children who are low birth weight and the median household income at the county level. Rankings are a great starting point to draw attention to problems that matter in your community, but don't stop at the rankings. Turn to the data, and then most importantly, use the data to drive action. With that, I'd like to turn the presentation over to Jessie and the What Works for Health team, who provide the evidence needed to move from data to choosing the best policies and programs in your community.
Thanks, Annie, for that overview of our data resources. So, once you have used data to think about challenges and strengths, then it is time to figure out what to focus on and how to improve it. Before I jump into What Works for Health, our evidence resource, I'd like to talk about the word evidence. It's a word we hear a lot within public health. Evidence-informed, evidence-based, and terms like proven, model, or promising. This word has different meanings to the various people and organizations who work in this space. Before we dive into what evidence means to us, I would like to take a minute and ask you to think about what evidence means to you. Please consider how you currently select strategies. Do you use your intuition or gut feeling about what will be effective? Is it based on what you have heard others are implementing in your field? Do you consider past experience with similar situations and strategies you might have used? Do you examine the results of controlled experimental studies that show that a method is helpful? Or do you factor in what you know by critically reading the literature in the field? When we in What Works for Health think of evidence, we focus on options 4 and 5, which are the results of controlled experimental studies and critically reading the literature. They are important considerations, but not the only things that should be considered. At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities and do so without reinventing the wheel each time. It really makes harnessing evidence easier for communities. You may explore strategies by topic or using a keyword search. Each offers additional filtering options to further refine your results. When it comes to selecting, developing, and implementing solutions to problems that affect our communities, evidence matters. Evidence can help drive smart investments and stretch the impact of scarce dollars, help inform decisions about when to adapt tried and true options and when to be more innovative, and inform innovation. Knowing what has been shown to work and what hasn't can help to ensure that innovative solutions are effective. We provide a menu of ideas within What Works for Health, presenting the available evidence and examples of where strategies have been implemented. By strategies, I mean policy, program, systems, or environmental change. What Works for Health is a living resource of over 400 evidence-informed strategies. We have done the homework and the literature review, and you can explore to choose which strategy fits for your community. For each strategy, we include an evidence rating, which conveys the likelihood strategies will work based on best available evidence. It is core to what we do and how this resource can be useful for you. It indicates which strategies have been shown to work, those that might work, and those shown not to work or cause harm. A short literature summary that highlights who a strategy can benefit, what it can do, and, as we have it, information about cost. We also include disparity ratings to help communities use an equity lens as they explore strategies, and implementation resources to move from idea to action. This slide shows an example of what a strategy looks like on our newly updated website. This is an abbreviated version of our paid family leave entry, meant to provide a quick glimpse of what all of the elements we've outlined look like when they come together to form a strategy. On each strategy's page, we include the title and a temperature gauge illustrating the evidence ratings. The completely green-filled gauge indicates that this strategy is rated scientifically supported, which is our strongest evidence rating. You can learn more about our evidence ratings by clicking on the blue information icon here. You'll see icons like this throughout the site. Please click on them to learn more. Turning back to the strategy, we include a description at the top and then move down through the expected beneficial outcomes. And here have space for just a snippet of the evidence of effectiveness section, which is our literature summary. Moving to the next panel, you'll see our assessment of the impact on disparities, which communities indicate they especially appreciate, and implementation examples and implementation resources, which we've heard undergraduate and graduate students often use in program planning classes. Some strategies may also include a community in action story, offering even more information. This is quite abridged, so please see our website for more detail. Now I'd like to draw your attention to some new features we've added to make What Works for Health more user-friendly. We now offer improved filtering and search capabilities, the option to print 2-page handouts with strategy details, my favorite new feature, which allows you to save selected strategies as you work your way through our resource. And after exploring our site, you can access your customized list of saved strategies and either email or download them. You can access the strategies you've starred throughout your visit to What Works for Health at the top of your screen, similar to a shopping cart. Once you've created the list of strategies you're interested in exploring further, You can download them to your computer or email them to yourself and your colleagues. Only interested in sharing some of your selected strategies? Just choose the right ones and pass them along. Your Save Strategies list will remain intact and will continue to appear when you visit our website, countyhealthrankings.org, until you clear your cookies. Now that you know the mechanics of how to save strategies, I'd like to provide a little more background on how you may settle on which strategies matter to you. We like to suggest an approach we think of as Evidence Plus. This approach connects the evidence you find in each strategy with your local culture and context. As you explore what works for health and read specific strategies, you'll find content to support this approach. Here's how you can do this. Start by asking questions like, does the strategy work? Will it work here? Then look at the details. Evidence ratings show the likelihood a strategy will work based on best available evidence. There's a field called Expected Beneficial Outcomes that will show you what it is rated for. Confirm these outcomes matter to you. Reading the Evidence of Effectiveness summary can help you know if a strategy is likely to work locally. Do you see populations like yours or communities like yours? Disparity ratings indicate the likely effects on disparities or gaps in expected outcomes. And implementation examples include toolkits, model policy language, and illustrations of how communities have put a strategy into action. There are numerous ways you can use what works for health. Carla mentioned earlier that stories are one of our program's greatest resources. It's important to understand what other communities are doing. Annie shared a few in her data overview, and I'd like to share a quick story about how communities can use what works for health in a variety of ways. Here's an example from a group working with our action learning coaches. The Health Foundation of LaPorte, Indiana, used what works for health in their grant-making process so that local organizations could search for programs and policy examples to inform their pursuit of grant funding. We know many funders want communities to use evidence to inform their work, and this can take a lot of the legwork out of that process for you. Thank you for sticking with me. To summarize, here are some of the key takeaways for what works for health. Evidence is an important part of decision-making, though we acknowledge it is not the only part. What works for health provides information about what works, what might work, and what does not work. You should connect the evidence available with your local culture and context to ensure you find a strategy that will work for your community. Now, I will turn it back to Carla and Erica, who will share the types of guidance we provide communities.
Well, thanks, Jessie, for that presentation. Okay, we talked about data and understanding community needs and assets. And we talked about using evidence to understand what communities can do to change outcomes. Where does this guidance fit into the picture, Erica?
Well, Carla, you know the work of transforming communities can feel intimidating. That's why we believe that by supporting communities with guidance about how to take action, coupled with who to work with, we can accelerate their progress toward improved health outcomes and health equity. The Action Center, which you will find under Take Action to Improve Health on our website, provides step-by-step guidance and tools to help you move with data to action. The Action Center answers the question, how can we take action? Each action step is broken down into key activities with guidance and suggested tools to support your work.
How can people get the most out of the Action Center?
Well, Carla, when you get to the Action Center, take a look at the steps to move your community forward. Where do you see your efforts? For example, are you assessing needs and resources? Or are you trying to choose effective policies or programs? You can choose the guides that are most useful for your stage of action. You can also think about, where are you feeling a little stuck? Maybe you're having trouble moving from assessing and planning to actually implementing the policy changes or programs you've selected. In that case, act on what's important can help. Maybe you struggle to get your partners engaged or to recruit diverse stakeholders to your efforts. In this case, our Work Together guide can help. Click on the guide that seems most useful, review the related key activities, and choose the one that resonates with you. I'd also like to encourage all of you to use the Action Center as a just-in-time resource that you will revisit to find the right resources when you need them. I also suggest setting the Action Center as a favorite in your browser. This way you can come back to it often.
Thanks, Erica. And just to share a quick example from one of the teams that we coached that used tools and guidance from the Assess Needs and Resources Guide. In Oscoda County, Michigan, the coalition was well aware of the challenges in their community, but what they needed to understand were the assets. So working with their coach, they turned to the asset-based community development tool in the Action Center to help frame their process for understanding individual and community assets that they could build on. This process helped them build momentum for community events and to open doors for collaboration. Okay, so let's talk about the Partner Center and the kind of guidance people can find there. Our Partner Center reminds us that we all have a role to play in creating healthier communities. By working together, we can achieve more than working alone. The Partner Center, which you can find under the Take Action to Improve Health on our website, is all about joining with others to make lasting change in your community. It answers the question, who should we work with? Think about the people in your community who make positive changes happen. We can call them leaders, change makers, or stakeholders. Whatever you call them, these are the people you want to partner with. How do you reach them? You start by doing some research to find out what their goals are and how they might align with yours. Think about what is in it for them. Find a way to get connected and begin to cultivate a relationship. The Partner Center can help you get started. It provides guidance around why different sectors might care about creating a healthy community, what they can do, and how you can engage them. How can people get the most out of the Partner Center?
Well, Carla, you know, the Partner Center is one of my favorite parts of the Action Center because I like to use the Partner Center to remind myself that many of us play different roles in our communities. We may work in healthcare, but we also serve on a government board. We may work for a nonprofit, but also serves as a funder. So start with the roles that you play in your community. If you do not see yourself in the sectors listed here on the slide, remember we are all community members, so start there. Then consider what other partners you may want to work with or know more about.
Well, that's great, Erica. And tell us a little more about this new resource called the Action Learning Guides.
That's right, Carla. I'm excited to tell you all about our action learning guides. They are self-paced, interactive guides that blend guidance, tools, and activities for hands-on practice and reflection. They're designed to support you and your partners as you deepen your learning on select topics. You can find them on the Take Action to Improve Health page of the County Health Rankings website. I think an awesome feature of the guides is that each have a companion worksheet that allows individuals to track their own progress through the topic or allow members of a group like a coalition to collaboratively, hard word for me to say, discuss the topic. Our first three guides are focused on introducing users to equity, the importance of partnering with residents, and how to get started with policy changes, pathways to improving community health.
Thanks for sharing that, Erica. What's new for 2020?
Well, for 2020, we've launched three new guides focused on data to move to action. They explore the importance of using data for health improvement and specific information and activities to help you get started using data and improve your data fluency. We've also added a new guide that will help you identify and implement strategies for action in ways that promote both health and equity.
That sounds terrific, Erica. What can the audience do if they want to connect with someone from our team about anything you've discussed?
Well, I would like for you all to know that Carla and I are members of a team of coaches with whom you can connect with throughout the year. There is nothing we enjoy more than talking to community champions like yourself working to transform their communities. We can help you navigate a tool, connect you with other community leaders doing similar work or addressing similar challenges, or simply serve as a thought partner with you as you plan your next step. Consider us as a resource. You can connect with us using the Contact Us button on our website.
So in summary, the Action Center answers the question, how can we take action? The Partner Center answers the question, who should we work with? The Action Learning Guides allow for a self-paced exploration of the topics, and our coaches can help you connect with any of the resources we talked about today. Sharing the stories of others ignites possibilities and inspires action. Our Learn from Others section provides multiple ways to find out more about what other communities are doing. You can find out about our upcoming webinars or watch archive videos highlighting community stories. You can read about the journeys communities have taken in our Community Highlights section, or learn more about the Robert Wood Johnson Foundation Culture of Health Prize. I also want to share another important part of the work that we do in collaboration with the Robert Wood Johnson Foundation and here at the University of Wisconsin Population Health Institute. The RWJF Culture of Health Prize honors and elevates communities working at the forefront of advancing health, opportunity, and equity for all. The 6 prize criteria displayed on this slide drive the selection of prize winners, and we believe are applicable and have value to any community working to improve. You can find more details on the elements of each criteria on the countyhealthrankings.org website. 44 communities have now been designated as RWJF Culture of Health Prize winners. The winning communities span 26 states, including 5 native nations. You can see that the prize recognizes all types of places: cities, counties, tribes, small rural towns, and interconnected regions, representing a wide range of physical, economic, and demographic characteristics. These places and their journeys are each unique, but they all show us what a culture of health can look like. We also want to briefly highlight new resources this year that features more information about past prize-winning communities. The Actions Toward Equity report, which highlights work across the first 5 years of prize winners, which may be of interest to you. The report includes specific examples of strategies communities are using to ensure everyone has a fair and just opportunity for health. Use the Contact Us button on our website to order one or many to be sent to you at no charge, or download directly from the address on the screen. Finally, we often get asked for specific examples of communities that are building a culture of health. For this, we really encourage you to visit rwjf.org/prize and look at the videos and stories of the 44 prize winners and learn from them, such as the 2019 winners: Broward County, Florida; Gonzales, California; Greenville County, South Carolina; Lake County, Colorado; and Sitka, Alaska. We encourage you to register for upcoming learning opportunities. You can access registration links to upcoming webinars, as well as recordings to past County Health Rankings and Roadmaps webinars via the link you see on this slide and the online resource guide for this webinar. You can follow us on Facebook, Twitter, or sign up for our e-newsletter. You can also share your input with us anytime via the Contact Us form on our website. A resource guide is available online accompanying this webinar. I'd also like to thank my colleagues Erica, Jesse, and Annie for being a part of this webinar. And we thank you and look forward to seeing you on the next webinar.